The research shows that women that replace their hormones as, mainly estradiol, progesterone, and testosterone have a over 30% reduction in all-cause mortality.
Wits and Weights community, welcome to another episode of the Wits and Weights podcast. Today, I am thrilled to welcome back the one, the only Karen Martel, a certified hormone specialist and transformational nutrition coach who's helped guide so many women to find new vibrancy through hormone awareness and optimization, especially throughout the peri and postmenopause phases. Last time Karen was here, way back on episode 31, where you can also hear her full backstory, we unpacked the complexities of hormones and weight loss during perimenopause. She's here today to uncover the truth about testosterone for women. You'll learn the role of testosterone in women's health and vitality, who might benefit from therapy, common questions about benefits, safety, dosage, and where all this is headed. And of course, you must check out Karen's top-rated podcast, The Hormone Solution Podcast, where she empowers women to navigate perimenopause and postmenopause with grace and knowledge. So many great topics and guests. Karen, I want to welcome you back to the show.
Thanks for having me back. This is great. I didn't realize it was so, because what are you at now? You're at like 200, aren't you?
Not quite there, but we're in the
Okay.
120s. Yeah, we're in the 120s.
Good job.
So when
Yeah.
this one's out, it'll probably be in the 130s. Yeah,
Yeah.
absolutely.
Yeah. So
Yeah,
it's been
so
100 episodes.
it has. And back then, I was using the TV tray in my closet. So I've upgraded a little bit since then. You wouldn't
The
know,
TV
right?
tray closet. That's awesome.
So, so
Uh,
it's good to have you back. I know a lot of my
Thank you.
listeners love your show and what you talk about. And, the stuff we do tends to complement a lot of what women are looking
Yeah.
for with the overall holistic approach to their health. So today we want to talk about testosterone. Hot
Mhm.
topic, very important. I think it's one of those hormones that kind of flies under the radar compared to
Yeah.
others like estrogen, but we know it's important. We know women know more about it. So let's
Mhm.
start with the basics.
Mhm.
What's the primary function of testosterone in the women's body? And then we'll go from there.
Mhm. Yeah, so women don't think of their testosterone, first of all, because
Mhm.
we associate it being the man's hormone. And it's an androgen. So it falls under the category of the more masculine hormones. But what's interesting is we actually, as women, produce more testosterone in our fertile years than we do estrogen or progesterone, which are the two main female hormones that most people heard of, estrogen and progesterone. And so they think that that's like our primary hormones, but actually testosterone is our most abundant hormone.
Mm.
And so the ovaries will produce about 40% of our testosterone, and they produce that first. And then that's converted or what's called aromatized into estradiol, which is our main female feminine hormone. And so without the testosterone, we couldn't be women, which I think is really
Mm.
interesting. It's like
Mm.
man makes woman, which, you know, maybe we go back to the whole Adam and Eve, and it wasn't a rib. Was it a rib that they gave or that he gave? I think it was the testosterone.
Testosterone.
It's like, here,
It's
we're
funny.
actually going to give you testosterone so you can become woman, which I just think that that's interesting. And what's on the flip side of that, men don't think that they need estradiol,
Mm.
but in actual fact, it is extremely important for men. And when men go on like aromatase inhibitors, which stops the conversion of testosterone to estrogen, they can get super sick and actually feel really bad and have bone issues. They can have
Mm.
depression, they can have low libido from not enough estradiol. So we both need these hormones, but it's just not recognized in women in the mainstream medical system. Like men will have their testosterone covered by extended medical if they have it. Here in Canada, it's covered. We have androgel, and it's in the States as androgel, and all the guys get it whenever they want it.
Mhm.
There's no testosterone made by a pharmaceutical company for women. I've heard of one like last year. I have yet to see it though, but I heard that there was going to be one coming for women.
Mm.
And so right now we can only compound testosterone replacement. And we'll
And
get
that's even
into
in
that.
even in the US, that's the case?
Even in the US.
Okay.
Yes. Yeah. So right
Okay.
now it's primarily compounded. I have yet to see anybody actually get this pharmacy brand of testosterone. So it's not covered for women, but men have it covered, which
Yeah,
is
men just walk into a clinic like, "Shoot me up. Let's get
yeah, there's
it."
testosterone
Yeah.
clinics on every
Yeah,
street
right.
corner these days, and it's all about, "Oh my gosh, don't God forbid you have erectile dysfunction, and if
Mhm.
you have one day without an erection, we're gonna hop you up on Viagra and testosterone and whatever you need so that you can have sex." And then these poor women whose testosterone is going down as their ovarian function goes down, testosterone goes down, and then their libido goes, but oh, that doesn't matter because we can still have sex even if we don't have a libido. So testosterone's number one, really important for libido. It's
Mm.
also extremely important to, of course, maintain muscle tissue and to gain muscle tissue. Without testosterone, it's really difficult for women to put on muscle. So if your testosterone's dropping and you're not able to keep up with your muscles and build that muscle, especially in perimenopause and menopause, will actually become more insulin resistant just from the drop of that muscle tissue. As you talk about lots, the muscle tissue is our glucose sink. And
Mhm.
so without it, women become very insulin resistant. It's part of that puzzle in menopause. Estradiol also, when we lose it, makes us become more insulin resistant. So we have this kind of double whammy happening where it's, that's one of the main causes of all the weight gain that happens for most menopausal women is that drop and then that insulin resistance coming up.
Yeah, I think that's a really excellent point, those 3 things. So for people who are listening, right? More muscle mass, more insulin sensitivity, easier to lose fat, easier to maintain your weight. The opposite is the opposite, right? Easier to gain weight. And so this imbalance that occurs or this lack of testosterone, how much of that is responsible for these inability to gain or maintain muscle mass versus other factors? Like, is it huge? Is it the main factor?
I don't know what the percentage is per se,
Mhm.
but I know that estradiol is also really important for protein synthesis and building muscle. So there are other factors. Of course, insulin is a big one too. If you are insulin resistant,
Sure.
it does make it harder to put on muscle. So there's different factors when it comes to that building of muscle. We also know insulin, like growth factor, has a lot to do with it because that triggers growth hormone, and growth hormone is also really important for building muscle. So there's a few different factors, but testosterone is certainly a really big player. And I've seen a lot, like countless women who start to replace their testosterone when it was low in menopause or perimenopause. And they're like, oh my gosh, look at my body now. And you see it on them. Like they suddenly have like they got muscle and all the work they're putting in at the gym starts to really pay off. I noticed it even in myself when I started testosterone therapy. I Mine wasn't even super low, but it was on the very low end.
Mhm.
And as soon as I started using it, it was like, "Oh, there we go. I can actually start seeing some muscle now when I'm working out." And it doesn't seem like it's like, "Okay, why am I not
Yeah,
putting
all
on
that
muscle
work without
here?"
the
Yeah, it's
results, yeah.
frustrating.
Now, what you talked about estradiol as a postcursor or whatever you'd call it of testosterone. What about the precursor DHEA? Where does that fall into this?
Yeah, so we make about 40% of that testosterone inside the ovaries, but we also, the other half is coming from the adrenal system. So we can make DHEA, which is another androgen, but it's also a pro hormone. So it helps us to make testosterone and estradiol. So, and it's also an adrenal hormone. So it's important for our stress and we want some of it. We don't want too much because that tells us that we're too stressed out. If we go too high on it, we can also start getting really masculine features. Polycystic ovarian syndrome, we tend to see high DHEA and high testosterone levels, and it's just pouring. And that's because women will be missing that enzyme that converts that testosterone into estradiol. So their
Mm,
estradiol tends to be low, and then they're pouring that testosterone out, and that makes them insulin resistant, makes them, get oily skin,
mm,
cystic acne, hair loss. So too much testosterone is also not a good thing. And too much DHEA is also too much, like not a good thing. As we age, DHEA also will start to go down. So we have to make sure that we're taking care of the adrenal system because then we can 40% is made in the ovaries. So without the ovarian function, we know testosterone is going to drop, but we know then we have to really baby our adrenals in
Mm,
perimenopause and menopause so that our the adrenal system can continue to make that testosterone. But
sure.
most women are super stressed nowadays, and so we rarely see DHEA in a good number in
Yeah.
menopause, unfortunately.
Okay. Yeah. Because I think it's important to understand these different precursors so that you can get at the root cause, right? You can do the right testing and not, overdo it with one thing when really the other thing needs more love and care,
Yeah.
right? Yeah.
Yeah, yeah, and there's ways to it's really hard for women to get testosterone prescribed to them,
Mm,
but there's because only 40% is made in the ovaries, there's a lot of things that we can do supplement-wise to help boost it, unlike estradiol and progesterone. That once we stop ovulating, we just don't produce progesterone. We produce a tiny bit from the spinal cord and from the adrenal system, but it's never enough. So testosterone, you have a bit more of a chance by taking supplements to help boost it even in menopause. So we can talk about what some of those are that I
y-
I like.
yeah. Let's do that. I want to know how women can boost testosterone naturally. We'll start there. Yeah.
Yeah, so one is your favorite, ashwagandha. We see that
Mm,
ashwagandha is really great for the stress system. So it's actually in a lot of testosterone boosting supplements,
mm,
which I appreciate that. I like ashwagandha too. So stress supplementation, so things that are going to support the adrenal system, which is always you want to test that first, test your adrenals, test your cortisol, test the DHEA. Let's see where it's at because some women are super low, some are super high, some just have dysregulation in the cortisol clock. So we really want to see where is it at so that we know what type of adrenal support that you need. Do you need something to help raise that cortisol and DHEA or do you need something to lower it because you're in that high stressed out state? So doing that first I think is super important because we can make so much of our testosterone out of those adrenal hormones. The other one is Tongat Ali, which is a really popular one for men. And in the research, of course, it's only been, I don't think there's any female studies yet on Tongat Ali for women, but it does work the same way and it does help to raise testosterone. And in the research, it's been like really just showed such a great increase in testosterone in a very short amount of time for men, but it does work the same for
How that's
women.
spelled? Tongat Ali.
Tongat, so Tongat, and then separate word Ali, Tongat
Oh,
Ali, and you
okay.
wanna try and get Indonesian Tongat, anywhere between 200 and 400 milligrams a day. Take it in the daytime because it does give you a little bit of a boost of energy as well.
Okay.
The other one is Fedosia arrestus, and there's been some good research on that too for men that shows that it can boost testosterone. So you will find a lot of testosterone boosting supplements that actually have both those ingredients in it. Another one is maca that I just love, love, love for all hormones, really. Like it really helps to boost DHEA, it helps to boost testosterone, it helps with estradiol. And my favorite company is one called Feminescence. And it's got I think it's four different types of maca that you choose from. And one is just for men, another one is for women in their fertile years, one's for perimenopause, and one's for menopause. And they all have a different color and strain of maca that goes more with what's happening in that person's phase of life. So if you're in perimenopause and your testosterone's dropping, estrogen's dropping, you could take that feminescence maca and it can really help. I've seen people reverse their perimenopause and menopause and like go back to a regular cycle by just taking that, which is pretty incredible.
That is
Boron,
fascinating. Yeah.
it
Boron.
is
Okay.
fascinating. Yeah, yeah. Sorry, there's more.
Bo
uh,
boron, the element boron? Yeah.
Boron the element at about
Yeah.
10 milligrams, actually.
Yeah.
So that's a much higher dose than what you'll usually see in a supplement. And it only works if you're deficient in it, which is
Okay.
interesting. So you can take it, it's not going to harm you to take it necessarily. If you have lots, I haven't heard any adverse side effects. It's a hard one to get tested. Of course, I think you'd have to do
Mm.
probably like hair mineral analysis or something. But boron helps us to lower sex hormone binding globulin. And sex hormone binding globulin is the protein that testosterone binds to and carries it around your system, but it has to get like become unattached from that protein for your body to use it. So I think of it as a bus. SHBG is the bus that our hormones get a ride on, but they have to get off the bus for the cells to use it and for your body to actually get that hormone. So if your SHBG is elevated, which functional range, we don't want to see it for women above 85. And if it is, it means that you could have a lot of testosterone, but it's getting bound up by that protein. So your
Mm.
body is deficient in it in the free levels. So always get free and total testosterone tested because you could have lots of total, but then you look at your free and it's all bound up by that SHBG and
Mm.
it's actually super low. So you're having deficiency symptoms.
Yeah, I want to get into testing in a second, just on its
Mhm.
own, so women know exactly like how they should get tested. But as we wrap up the supplement section, I think what's nice about these kinds of supplements, being that they're herbal, they're easy to access, is you can do sort of an elimination diet or the reverse of that, right? You can try one at a time. I mean, if you try them all, one or two might work, but you don't know which one it is, right? So
Yeah.
do it
I
that
can
way, and
actually
then yeah,
recommend a good
go ahead.
supplement that has all of it in there except for
Okay,
maca.
okay. Is
If
that
you
so do you recommend doing that versus just trying, like, a few and then seeing if one is the big hitter for you? Or is it kind of a crapshoot when it comes to that?
I think you would get success with, let's say, just using maca or just using Tongat.
Mhm.
Those would be my 2 top favorites for boosting testosterone. Uh, but I think you would get more success with raising testosterone if you had them all in there
Okay.
because it's, you're hitting all the angles. It's got zinc in it. It's got all the things. And so my favorite as of right now is called Sigma, and it's by a company called Gorilla Minds. I'm not associated with them at all.
Mhm.
I've just seen it work really well. And it's got the Fedoja arrestus, it's got Tongat in proper form, like in proper levels. And it's got the zinc, it's got the boron in proper levels as well, and
Okay.
some other stuff in there. So it's got
Sigma by
ashwagandha.
Gorilla
And
Minds.
yeah,
Okay.
yeah.
Oh, that'll be good. Yeah, and I mean, again, as a coach with women with these issues as well, I would be looking at that and suggesting it to people, so that's good. Let's go back to testing, right? Because
Hmm.
testing is always a point of confusion, especially in the traditional healthcare system, where it's like, if you could even get them to give you a test, it's blood work, and usually that's not adequate. But it might be for testosterone. So
It
let's break it
is.
down exactly. That's one thing that makes it easy, right?
Yeah.
So how should a woman find out that they're a candidate, or not find out a candidate? Get access, get tested, and then use the results properly.
Mhm. So, once again, some really shitty man to woman things here, which is testosterone's the only one that they'll ever test free and total.
Mm.
Women, they won't do estradiol free and total or progesterone free and total. It's only testosterone, which is a little bit frustrating. But that's a very accurate way to test your testosterone. And testosterone, we have a little bit of a peak right before we ovulate, I think, to give us that drive to go out and have sex and procreate. But pretty much we don't fluctuate like we do with our other hormones throughout the month with testosterone. It stays pretty even keel. We have that little flux on day 12 right before we ovulate on a 28-day cycle. But, besides that, you can kind of just test whenever in the cycle. You probably don't want to test on that peak day. Day 21 is what I would recommend because that's where we test the estradiol and progesterone in fertile women. So might as well do your testosterone then too. And so it is very accurate, but you definitely want to do both free and total in case your SHBG is too high. And then test your DHEA sulfate in blood. Test your sex hormone binding globulin. So we see if it's elevated. Because one of the things that's happening right now is that a lot of women are fasting and fasting, like hardcore
Mhm.
fasting, 1 meal a day, 2 meals a day, and they've been doing this for a long time, or they've been eating a really low carb diet, and when they're fasting and not eating that much, they're also really low in protein. So
Mhm.
low protein diets, low carb diets, too much fasting will all raise SHBG because it makes sense. If we were back in hunter gatherer days and there wasn't a lot of food around, so we're fasting, right? Then the body is being told, "Don't get pregnant, there's not a lot of food around."
Mhm.
And so SHBG naturally would go up because there's a food shortage, so it wants to bind up your testosterone, bind up your estradiol, and so that you can't get pregnant. And so
Mm.
too much of that starts to signal to the system, don't get pregnant, which that's really the only reason why we're here. So your body's going to compensate for this, whether you like it or not, whether you want kids or not, or care about being fertile. This is what happens. So we have to be really careful with that. So
So
testing, that's a good idea. Yeah,
let,
go ahead.
let's so a couple of things, because I actually just I put together a new episode about carbs coming out, and one of the interesting things about a higher carb diet was the increase in testosterone to cortisol ratio that they've seen. Not in addition to the increase in IGF-1 that you talked about. So the fasting and the low carb and the low protein, are you saying that in general for most women that's not recommended because of this, or what are you saying there?
It's a fine line is what I'm saying,
Okay.
because we also become more insulin resistant because of the drop in hormones as we age, which means intermittent fasting can be a really, really important tool to start
Mhm.
implementing, because we need help being insulin sensitive. It's that women are taking it too far.
Okay.
They get results and then they're like, "Oh my god," and then they stop getting results and they think, "I better do it harder,
Harder.
longer." Right? Like, I
It's
better,
true.
"Oh, if
Yeah.
I'm eating 2 meals a day, I better eat 1 meal a day.
Yep.
Oh, I should be doing a 36-hour fast or a 5-day fast." And you hear this from a lot of, like, of the big practitioners that are out there on social media saying, like, do 5-day fast once a month, do one 36-hour fast every single week. And I'm like, no, most women can't handle that, especially in menopause. It stresses the system out too much. So you have to find that balance. You have to know where your cortisol levels are. You have to know where your insulin's at. So testing, of course, is super important. We don't want to guess what's happening in the body. So some women that are insulin resistant, their cortisol is okay, or let's say it's high, then I would probably say, you know what, you need to be intermittent fasting more, but you still want to make sure you're getting in the protein, because if not,
Yeah.
then that SHBG will go up and it'll bind up those hormones. The other thing that will raise it is thyroid hormones. So if
Mhm.
somebody's on thyroid medication, which a lot of women are, they don't realize that that's actually binding up their hormones and sending them into menopause early, which is something that happened to myself and nobody told me. And I was like, "What? What's going on? My total levels of estradiol and testosterone are great, but yet I'm missing a period. I'm getting hot flashes, low libido." And then I finally heard Peter Attia who's huge. He was on Huberman Lab podcast, and he was talking about thyroid medication raising SHBG. And I'm like, what the frick? Why isn't anybody talking about this? Like, how many women are on thyroid hormones? So many.
A lot, yeah.
So,
Yeah,
yeah.
it's this is why women are so frustrated, right? And
Yes.
because it's I could just imagine like a piano of keys, and every single key is like a different hormone, and as soon as you press one, the other one goes up or down, and they're all so interrelated, right?
Yeah.
And
Yeah.
even the thing about energy availability, which shameless plug, that's what we talk about on your podcast when my episode comes out. Energy availability is that you need the energy there to support your hormones, but you don't want so much energy that you're gaining a ton of weight, right? And that's where it's like this balance
Exactly,
of
exactly,
for
and
women to find that.
everybody's
Yeah.
different. Like,
Yes. Yes.
we gotta get away from this one size fits all, because
Yep.
even though we know that, we're still doing it. The majority of women are still going, "What's
Mm,
the next best diet out there?"
mm,
and
yep.
trying it, and, "Oh, everybody's doing keto, well, I'm gonna do keto," and it's like, "But is that a good fit for you? Like, where's your thyroid at? Where's your adrenal system at? Where are your hormones?" Like, you gotta look at this full picture and then decide, okay, I'm, inflamed, I've got PCOS, I'm insulin resistant, then
Mhm.
yeah, keto could be great and it could reverse all of those things. But then you want to, start carb cycling, and there's a lot of nuances to
Yeah,
it, and
agree.
everybody has to find what's going to work for them.
So going back to the blood work, free and total testosterone, DHEA sulfite, SPBG, what else?
SHBG, yep. And then, of course, you
SPBG.
want to test your estradiol and progesterone as well, because there is some evidence that shows that women should actually be, like, if you're going to replace your hormones in perimenopause and menopause, there is some research that shows it's actually better to replace estrogen and progesterone first for 3 months, then put in the testosterone. So
Hmm.
I always want to see that full picture. The other way that I want people to test is through urine metabolite testing. Now, oddly enough, testosterone is actually the least accurate on urine metabolite testing.
Mm,
So you think, okay, well, then why are you saying that we should do this, Karen? Well, in a Dutch test, which is dried urine hormone testing, we have testosterone on there. We've got the DHEA sulfate on there. But if you have a genetic SNP where you're missing these enzymes called the UGT enzymes, you won't pee out that testosterone. So it looks
Mm,
like you have none when you actually have plenty. So I always want women to do blood work on the same day or the next day so that we can compare the two just in case.
mhm,
It's more common in Asian backgrounds. So if you've got, if you're Asian yourself or you've got Asian in your family history, then you may not have that enzyme. I don't have it, so I always look like I have low testosterone. But the other piece of the puzzle that we wanna see on a urine metabolite test that blood work won't show is something called 5-alpha reductase enzyme. And so there's a fan gauge on the Dutch test, and there's 5 beta and there's 5 alpha. If you are leaning towards a 5 alpha pathway, so on the fan gauge, if you're way over to the 5 alpha, it means you convert your testosterone at a higher rate to what's called dihydrotestosterone, which is the most androgenic out of
mm,
all the androgens. And so that's where we'll see women, if they go on testosterone replacements, then if that goes up, the DHT goes up, they start having the hair loss, the greasy skin,
yep.
the acne, and so that's not pleasant. Women can get whiskers, have, can start growing the clitoris, as I call it, so your clitoris can actually start to get longer, and you
Okay.
yeah. Which is not fun, and I've heard of women this happening to them, their voice cracking, and just from being on testosterone replacement
And that's if
therapy.
you lean more toward the alpha side, you said?
Correct. Yeah.
And does that mean you shouldn't be taking therapy if that's the case, or you just have to modulate it and be more careful with the dosage?
Exactly, and you have to possibly take something that's going to stop that
Mm,
conversion, so it
mm,
blocks the 5-alpha reductase pathway. There's herbals that do it, there's also medication, finasteride and dutasteride that will block that conversion, so a lot of women will take the medication so that they can get the benefits of testosterone without having the
okay.
masculine features. But there's lots of that, like saw palmetto is really good for it, pumpkin seed, there's a bunch of different things zinc that can help with that.
Before my coaching session with Philip, I was really struggling with staying consistent with my nutrition. Philip really showed me the importance of being consistent day to day. He also helped me see that it's not a bad thing to take a rest day. He really helped me get in that more positive headspace of a rest day being something really good for me. I've been doing this for a month now, and I'm finally starting to see some progress in my numbers, and I'm really excited about that. And I just appreciate so much the help that Philip has given me. He's always willing to answer questions, to offer resources that are totally free and very, very helpful. So I just want to say how much I appreciate that. Thanks, Philip.
This is all fascinating. Let's continue the story here, right? So we've talked about testing, we talked about natural supplementation. Now we talk about testosterone therapy in more detail. So
Yep,
what are the options women have then to
yep.
do that?
So, we have pellets, which are becoming very popular. There's a lot of pellet clinics now for both men and women. So, pellets are these little tiny seed looking, they look like a seed, and they get implanted into your butt, and then they will release testosterone for 3 months, sometimes 6 months. Not my favorite, and I'll explain why, but besides that,
I've
we
heard of
can
that, yeah.
do injection,
Mhm.
which is my favorite. We can do cream, topical cream on the skin, and we can do troches, and we can do oral. So a troche is a little like you suck on, like you put it down in stick it down in your gums, and you just let it dissolve, and it's they think they're gonna tell you that, "Oh, it's gonna absorb into the salivary glands and go into the system." When actually you're gonna swallow about half of that, and that's a problem. So
Mm,
as soon as you start swallowing testosterone, so whether you're taking it as an oral capsule or you're putting the troche in your gum, then it's going to raise SHBG.
mm,
And that's going to then bind up the testosterone and estrogen. So, and it also can cause inflammation because it has to go through the first hepatic pass of the liver. So it's the worst way to take
mm,
testosterone is oral. So never ever do it orally. Pellets, the problem with pellets is once they're inserted, you can't get them out. So you have to wait for them to dissolve, and that takes about 3 months.
Mhm.
And I have seen so many women who have done pellets who have a negative reaction. So maybe they go down that DHT pathway, and I see them lose their hair, they gain weight, they get greasy skin, cystic acne, we get super water retentive, and they've got to just sit and wait for it to come out, which is horrible. And
I
so, like,
see.
I've talked to women that gained like 20 pounds in 3 months being on pellet therapy. Like, that's how bad it can be. So, if you're gonna do pellets, I ask that you first do a different method so you know how your body's going to react.
Interesting. Okay.
Yeah, most people that are trained in pellet therapy, it's a bit of a cash grab. It's expensive. They're not trained about female hormones. Like, I have yet to come across a really good pellet doctor. I know they're out there. Don't get me wrong.
Mhm.
I think there's some out there, but there's a lot that are horrible and they don't know anything about the female hormonal system, and it's all testosterone, 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 and these pellets are in such high doses that they're really androgenizing women. And so you'll do their blood work a month in and it'll be hundreds. Like, top end of the range is 50. I've seen women in the 400 range being on pellets, and they're getting whiskers, their voices crack, like, not this is not good. We're not men. We're not trying to, transition to men. So we have to
Mhm.
be very careful, and these doctors, these pellet doctors, a lot of them, they won't give estradiol, they maybe will give progesterone, but they're very focused on that, like, "Let's get your testosterone sky high," and I
Okay.
just don't agree with that. And so injection seems to be the best. I've worked with hundreds, if not thousands, of women now with testosterone therapy. I've run the gamut of each of these things. I've seen what it looks like on labs, and injection seems to be best way to get your levels up and to absorb it and take it into the system. For some reason, cream, it doesn't work as well. It still works, but I find you have to use a higher dose of cream to get the same levels that you would by using injection. So injection, you do like a once or twice a week shot, and it really does seem to work well for raising a woman's testosterone. And if it's too much, then you can lower it like the next week if you want to,
Mhm.
which is great. So if you're getting some negative symptoms, no problem. Let's lower it. Same with cream. We can reduce that dosage is great. Cream is awesome too, and it can be really helpful, especially for sex. I always recommend to women that are having some sexual dysfunction and dry vagina. When women start to go through menopause and perimenopause, they can have really subpar orgasms. When they used to have these great orgasms, and then suddenly they're like, what the frick was that? Like,
Mhm. Yeah.
and so testosterone rubbed actually on your labia and clitoris prior to sex can actually really help a woman to have a proper orgasm. And it's okay to transfer that to your male
True.
partner.
That's
Yeah.
interesting. Yeah. Yeah.
Mhm. Yeah.
Okay. So stay away from pellets most likely,
Yeah,
unless
I
unless you
would.
test them out first.
Yeah.
The troches is oral. Don't. That's the worst way.
Yeah.
Topical cream could work, but you need more of it. And then there's libido aspect, and then the injections are the best. And these are tiny needles put in your muscle tissue, right?
Yeah. Yeah, you can
Yeah.
do
Just
sub Q or you can do muscle. I personally do sub Q
okay.
because I don't know, it's a bit bigger of a needle to go intermuscular, but
Sure.
most of me can handle it for I'm a bit of a chicken.
No, I imagine people select these other options simply because they don't want to get to inject themselves. So we just have to try to assuage their fears that
Yes.
this is super. I imagine, right? Like I don't
Yeah,
know.
yeah,
Yeah.
yeah,
Okay. So great. Now we talked about treatment. Going back to the symptoms and the testing. Is the testing
yeah.
the exclusive way you're determining that you need it, or is there a symptom aspect to it? I know for men, it's definitely a combination of the two usually.
Yeah. So what's interesting is some women come into this world being more androgenic and
Hmm.
some are more estrogenic. And this has to do with our DNA genetics, right? So when you get a genetic profile, you can actually see if you are more androgenic or estrogenic. And that means that your body will depend on that hormone more than the average woman. So I always use me and my sister as an example. I was born into this world very estrogenic. So I had a history of endometriosis. I've got ovarian cysts. I'm very curvaceous. I've got breasts. I've got hips. I got a butt. I'm always prone to weight gain. And then you look at my sister, and she's like this little tiny beanpole that can eat as much as she wants and never gain a single pound. She's super wiry. She maintains muscle. She's got a great libido, and she just will never gain weight. Like, it's crazy. And so when her testosterone drops, she really feels it. When
Mm,
I lose my testosterone, I don't notice it that much.
okay.
It's like, okay, yeah, and so when I put it back in, like, I notice difference in the muscle and a little bit with the libido. And it's like, yeah, I can feel it a little bit. But for her, she takes testosterone, and it's like, oh, like, she just, it's amazing because she's more androgenic. So your levels could look like they're in range, but if that's low for you and you're getting symptoms of low testosterone, and so somebody would maybe be gaining weight, fatigue is a big one, foggy brain. Testosterone is really important for our heart, our breasts, our bones. And so if you start to see these problems coming and your testosterone's not, it's not in that upper third quartile on the range, that might not be, then that's saying that you probably don't have enough for you.
Mhm.
And so you want to maybe start supplementing with a little bit of testosterone. So we want to always test, but we also want to go by how somebody's feeling. And so
Yeah.
if those symptoms are arising and that person's not being able to put on muscle tissue, they've noticed a big drop in their libido, and they're really foggy brain and they're super tired. And it gives a woman, I always say this, it gives you your balls, your lady balls. And
Mhm.
that, when I say that, I mean, it gives you your drive, and that, like, I'm going to go out there and get stuff done. And I'm going to, so for business women, and for women that are like in that kind of go, go, go lifestyle, it can be really important to have that testosterone at a good level. And even just stay-at-home moms, I mean, we all know how stressful that is and how tired. I think that's a harder job than being a high-up businesswoman.
No
So,
comment. I mean,
yeah,
all women
yeah,
in the world that are working hard at
yes.
something are, to be valued.
Yes.
They're all working hard.
Yes. Yeah. So some women can really notice it with
Yeah.
with that fatigue and just not feeling like they want to get stuff done in their life, and they're
Okay.
just like have that low self-esteem, and that there's just no get up and go. So that can be testosterone.
Yeah, no, I wanted to ask because there are big differences between men and women and how they feel these differences. Like for men, it's like, do you feel more like a woman than your testosterone's low? It's kind of like simplified like that. Are you
Yeah.
crying more? Are you sad? Or all these other things? But what you described is a little more unique set of symptoms for women, given women have like a fraction of the testosterone of men, and you're already not androgenic to begin with. So it's not like you necessarily notice that difference, right? So
Yeah.
combining the testing with the symptoms is a great strategy, of course.
Yeah,
What
because some
about
women, when
yeah.
they do use it, like, some women will report, like, absolutely incredible results. Like, they're
Hmm.
just like, they love their testosterone because they're like, "Oh my gosh, I feel like I'm alive again. I can get out there, I can exercise, I have energy, I feel amazing." And it also, for women with a history of breast cancer, it won't convert into estrogen in the breast tissue. So you can actually use testosterone therapy safely if you
Mm,
have a history of breast cancer. You,
that's a
of
good
course,
point.
want to talk to your oncologist about that.
And how young, not how young is too young, but at what age should a woman get tested even if they don't have symptoms? What's a good like baseline age?
In your 20s or 30s, early
Okay.
30s. Yeah, because we start to see testosterone going down typically in mid 30s in women. Sometimes in your 40s it'll start, but that's when we start to lose most of our hormones. We tend to go into perimenopause, which is the beginning of the loss of these hormones and ovarian function between the age of 35 and 40. So to get a baseline when you're feeling good is a great idea. So if you're in your 20s, early 30s and you don't have any symptoms of low testosterone, yeah, go get it tested now so that when you start aging and going into perimenopause and you start losing that libido and muscle tissue, you can then test and compare and be like, oh, so it was 40 when I was in my 20s, but yet look at it now, it's at 14. And
Hmm.
so clearly I need to boost it and get it up to 40 so I can feel like I did when I was in my 20s.
Exactly. Because then it's
Mhm.
relative to you. What? So let me ask you this question: when would a traditional doctor or GP recommend that you get this tested?
Never.
There you go. You gotta own your health, people. You gotta take control of this stuff.
Yep.
So true.
Yep.
Yeah.
Yeah.
And I know that's what you're all about, and anybody listening knows that, but still, we gotta do that. So
Yeah.
don't
Well,
wait.
all
Just
doctors
get
will
it
just
tested.
tell you, "Oh, yeah, you're in range." And
Yep.
the range for women is
If they even get it tested. If they
if they
even
even get it
it's
tested,
like, "No, no, no,
like
you're 30, you're too young." That's what they'll say, right?
yeah, it's ridiculous. Like your
Yeah.
free testosterone, if you're between like 0.5 and 5, you're good. What? And then like total testosterone, if you're between like 10 and 50. And it's like, no, like we want to see you in that upper range, mid range, and above with total testosterone. And free testosterone, I want to see around 3 or 4.
Yeah.
So keep that in mind when you go to get tested because your doctor is going to be like, you're great, you're in range, even though you're
Mhm.
like 0.1 away from being flagged as too low. They'll tell you you're fine.
Right, and there's so much of that in life with, like, the minimums, it's like, we're not trying to just survive and get by here, people, right? It's
Yes, we're optimizing.
yeah, we're optimizing,
Yes,
so,
yes, and I'm
yeah.
gonna just say too, something that I really, really try to get across to women is once you lose ovarian function, which typically you'll start to really drop in progesterone first, you can start slowly dropping in testosterone, and then in your mid-40s to 50, then we drop in estradiol. There's no amount of dieting, exercising, fasting that will bring back ovarian function. So as
Mm,
even though testosterone is one of them that we still will be producing a lot of the time out of our adrenal system, most women's adrenal systems are shot as we discussed. So you really want to like if the natural stuff doesn't work,
yeah,
please keep in mind that there's no way to bring back ovarian
yeah,
function. You
it's not
can't
gonna come back, yeah,
supplement your way out of not ovulate like out of the low ovulation and the low eggs. Like you can't bring back egg count, you can't bring back ovulation. It's going to end. We used to die at 45. That was the average age for women. So as we started going into menopause, we typically die.
yeah,
Now we're living longer than ever. And so without these vital hormones, you can only get so far with your health because you're missing all of these hormones that are crucial for so much more than just sex and procreation. We need these hormones for, like I said, testosterone is super important for bones. And, if you have a hip fracture, you have a 50% chance of dying within the year. Like, that's
mhm,
crazy. Osteoporosis, like, you will get osteoporosis if you don't replace your hormones. We need them. And so the alternatives is of course medication. A lot of women will get depressed, anxiety ridden from losing these vital hormones. And so I just want everybody to keep that in mind. The research shows that women that replace their hormones as mainly estradiol, progesterone, and testosterone have over 30% reduction in all-cause mortality. We know
mhm,
that heart disease can be reduced by like 49%, which is the number one killer of women. It reduces cardiac mortality by 49%. That's crazy.
yeah,
So in Alzheimer's, we just a great study came out a couple years ago on like I think it was like 400,000 women that showed women that replaced estradiol for 6 years or longer had 75 to 80% reduction in developing Alzheimer's. So and testosterone is really important for the brain as well. So we just want to keep that in mind that it's not just about libido and there
mhm,
is just so much of that the biohacking that we can do to bring
right.
back those levels. And so just keep that in mind.
Yeah, it's like a battery that's capacity keeps dropping and dropping and dropping. You can only charge it even if you do everything perfectly, you only charge it to 50%, then you can only charge it to 25%. You need this extra battery, I guess, from the TRT and the replacement therapy.
Yeah, and same
Is
with
how to
for
think
men
about it.
too. Like,
Yeah, for
not
sure.
all men lose their testosterone like women, but like we drop in hormones far more than you guys do.
Yeah.
But there is menopause, and that is the loss of DHEA. You can lose your progesterone, your estrogen, your testosterone. And those are vitally important, especially, of course, testosterone for men. And so
Yep.
you really wanna watch that if you're not waking up with an erection in the morning, if you're having poor orgasms, if you're, have erectile dysfunction, just depression for men, high cholesterol, high insulin, fasting insulin and blood glucose. These are all signs that you could possibly use a little bit of a testosterone boost as well.
For sure. I mean, and for men, it's like if you're training well, if you're eating well, get your blood tested, you've got the things covered. You still may need TRT, and it's good to have that baseline, no matter what
Yep.
age you are. Same thing with women. 30 years old, it's great. Get it then. Get every 5 years or so. See what happens,
Yes.
and treat it. And once you start treatment, you have to be on it for life. But that makes sense because it's not coming back.
Yeah, and
Yeah.
and your men think, "Oh, but if I start using it, then that's it. I'll never have testosterone again." But actually, it shows that in about a month after stopping TRT, your levels will come back to where
To where they were,
to where they were. Yeah,
which were probably inadequate. That's why you took TRT. So
exactly.
it's like
Yep.
it's like
Yep.
there's no harm. Yeah,
Yeah.
exactly. Okay, what about we talked about the androgenic symptoms. Are there any other side effect symptoms women should be aware of that would be indicated by too high of a dosage or potentially misalignment with their therapy?
Weight gain, insulin can go up, blood sugar can go up. That's like the common PCOS, polycystic
Mm,
ovarian syndrome, which is the leading cause of infertility in women right now. That is too high of those androgens, as we discussed. And so you could lose your period, you have blood sugar problems, not ovulating, and then all the other ones on top of that, like the hair loss is a huge one, especially if you've got too much DHEA, will cause a lot of hair
okay.
loss and acne. Same with the testosterone loss. So, I mean, too much testosterone, too much DHEA will cause the hair loss and cause the acne. You can get dark hair on your arms, dark hair where, just in places you don't want it. So more hair growth on the body, but less hair on the head, which sucks. Yeah, I think
Okay.
that's it. Yeah,
That's
that's
a scary enough
some
picture
women,
that
their labia
yeah,
will
yeah,
get swollen,
yeah.
which is very uncomfortable. So I have heard that from a few women when they're on too much testosterone, very uncomfortable. Their everything kind of engorges down below.
So the message is get tested and modify your dosing as appropriate often,
Absolutely.
yeah, or
Yes.
frequently. Yeah.
Yeah. Yeah.
Okay, what's in the future for all of this? Like, are there any big changes coming in terms of either the approaches or the therapy itself?
Not that unfortunately, it's still there isn't a lot of research for women and testosterone.
Mm,
Actually, I was just at a conference over the weekend, and a woman that did one of the talks said that it wasn't till 1993 that women were even allowed to be in scientific research studies
hmm.
because we could get pregnant. And so
Oh yeah,
we've only just been in studies for hormone. Like it's crazy.
for a lot of
So
things, for a lot of things
for
with women's health.
for
Yeah,
everything.
it's
Yeah.
true.
Yeah, not just
It's crazy.
hormones. Yeah.
Yeah, how little
So
we know about women's
yeah.
health at
So
this
it's
year.
changing,
Yeah,
but very slowly.
yeah,
And so it's just about educating women about the importance of their hormones and that testosterone is one that you really want to watch because it can really help with, just overall vitality and
yeah.
aging well.
It'll be ironic or maybe appropriate if one day insurance companies realize, hey, if we had gotten on this sooner with hormone therapy, we wouldn't have such high costs of all the effects of, this added weight gain and stress on the system and poor health that are related to hormones. But, they
But
don't think
health
long
doesn't
term.
make money. It
No,
doesn't make money
that's
for
true.
pharmaceutical
Sickness
companies.
makes
So
money.
yeah,
That's right.
yeah.
That's right.
So they
Fair
want to
point.
keep us sick.
Yeah.
Yeah, it's
Um,
unfortunate. Yeah. So
it
good
is.
work with a good hormone practitioner.
Yes.
Not somebody that's in it just to, it's like these pellet clinics are like the worst for just kind of
Mm,
how many people can we get through here? It's not it's there's no holistic approach. You want to work with somebody that's going to find what's going to work for you and be able to, if you start getting these masculine symptoms that they know what to do and that they're not forgetting about these other very crucial hormones because they all work synergistically together. And so we want to look at everything.
And Karen is, and I know she wasn't trying to plug herself, but Karen is one of these wonderful people in the world that
But
do
I'm
that.
always
And
like,
I've
just find somebody. You don't have to
find
find
someone.
me. You just
Yeah,
find somebody.
true. And especially depends on where you live. Like in the US versus Canada, you might have different access to different things. Because I've heard some people here do get coverage for certain things that you might not in Canada and vice versa. So just got to
Yeah,
get educated.
exactly.
All right. So
Yeah.
is there any other question you wish I had asked here related to testosterone or anything else?
I
And
guess
if
maybe
so, what's your
how what
answer?
I have to offer, which I do work with a team of doctors who
Yes.
run a focus is on testosterone. And so we can prescribe in every state, which is really cool. We can prescribe in Alberta, in British Columbia, and soon to be Ontario and Canada. Because and I want to say that not to plug myself, but because testosterone's extremely challenging to get for women. Normal medical doctor, your medical doctor doesn't know how to prescribe it for women. They're just like, "Oh, I have no clue what to do here." Like they're not trained in menopause, they're not trained in perimenopause. I've heard they get like less than 7% of doctors are trained in menopause in med school. So you're going to have a very hard time finding a mainstream medical doctor who will properly prescribe you hormone replacement therapy. So,
Karen, I just have to back
yeah,
that statement up. I, I've never heard, and this is anecdotally from so many clients and women in my life who have GPs, male or female GPs, but even males who just they're 60 years old and they've been working with how many patients all these decades, and it's like they're clueless.
they're
I mean, it's
clueless.
it's
Yeah.
crazy. I don't
Yeah.
know. There's no continuing education. There's just
No.
nothing. So it's
No, they
important
have
that
to
people know that.
pay
Yeah,
to become educated in bioidentical hormone therapy. They actually have to
yeah,
pay for the course or
yeah.
courses. There's
It's
a
not
lot of them.
incentivized. Yeah,
No, it's not
yeah,
taught in med
yeah.
school. They're all going by old studies that were falsely represented, and like there's so much horrible things that are going on in the medical system for women's health. And
But
so we
what they will give you is the
is an
pill
antidepressant or the
or
birth
the pill.
control.
Like
Yes.
when
Yeah.
you're 14, they'll give you that. Okay.
Yep, yeah, which causes way more
Cancer,
risk for breast
everything else.
cancer, and,
Anyway,
like, it's terrible.
yeah,
That's a whole
yeah,
nother
yeah.
episode.
We talked about that last time actually
Did we?
on
Okay,
the
good,
yeah, so
okay.
yeah.
So everybody can go back and listen to
Yeah, yeah.
that, but, yeah, it's very challenging, and women need to realize that their medical doctor, sure, go give it a shot because a lot of it's covered probably.
Mhm,
So try. It's always good to
mhm.
try,
Sure.
see if they'll work with you. But if they don't, then let it go and don't get angry at the medical
Yeah.
system. And I had somebody recently message me and say, "I'm so mad that I have to pay for this."
Mhm.
And it's like, well, but you have to realize that doctors aren't trained in this. So they're not the people that we should be going to for it
Yeah,
unless that this is their specialty, which our doctors are. They specialize in
yeah.
hormone replacement therapy. Been properly trained. I've been properly trained. My nurse practitioner has been properly trained.
Mhm.
So you want to find somebody that has been specifically trained in bioidentical hormone therapy,
For
and
sure.
that's likely not your family doctor.
And like you said, everything related to wellness versus sickness, everything related to wellness, you probably have to take in your own hands, whether it's
You
your
do.
nutrition, your exercise,
Yes.
your hormones. You see, it's
Yeah.
all starting to connect, right?
Yeah.
Cool. So then, where can listeners learn about you? Where do you want them to reach out to you?
Yeah, so we've made sure that we've been able to help any woman that wants to get the help. So we have different tiers. We've got, high end 4-month packages where you get that one-on-one help, you get your prescriptions, you get your hormones, etc. And then we also have group coaching. The group coaching program's been going for about 6 years. We've got almost 200 women in it, and you can get a lot of help through that. We have weekly group coaching calls where we'll look at your labs and give you recommendations to take to your doctor or to your prescriber and say, hey, this is what they've recommended. I need some estrogen, I need testosterone. And then we've also got nurse practitioners that you can book with and take the recommendations to, and they'll prescribe it. And then I'm coming out with my own line of over the counter hormones so that women can get them even if they don't have a lot of money. Now you can't buy testosterone over the
Mhm.
counter,
Right,
but
right.
you can estradiol and progesterone, which are very key for replacing when you're in perimenopause and
Mhm.
menopause to mitigate those symptoms and to have optimal health. So I've created my own line so that women can just get it without the prescription if they feel they need it.
And this
And
is
it's a
at
cosmetic cream. It's not a yeah.
Cosmetic. This
Yeah.
is at your website, KarenMartel.com?
It's coming. I don't know when this is being aired, but it'll be here by the end of the year.
Oh, okay. So this is a whole brand new place to find all this. Okay. All right.
Yeah.
Even
Yeah.
even with coaching and everything else, we're not using your website. There's another
No, right now it's gonna just be on my website,
okay. Okay.
KarenMartel.com. Yeah,
Okay.
and then social media, I'm Karen Martel Hormones, and then the podcast is The Hormone Solution.
Yeah, right. And that was you renamed that a few months back, right?
Yeah, it
Hormone
used to be
Solution
The Other
Podcast.
Side of Weight Loss, and now it's the Hormone Solution podcast because it was just so much to do with hormones.
Awesome.
It was
All
time.
right. Well, this episode comes out in early January, so if you have any updates, we can connect and put it
Oh,
in
for
there
sure.
for
Great.
folks. Cool. This has been a pleasure. I'm glad we got to go really deep into this one area of testosterone. So
Yeah.
important, not talked about enough. And it's been awesome, Karen, to have you on. So thank you.
Thanks for having me on.